get you a bed.
Mom, it's gonna be okay.
Come lay down.
I got bit by I was feeding the chipmunks this morning, and one of them bit me. I think it was a vampire chipmunk.
Okay, let's take a look here,
let's
okay?
look at this.
All right, yep.
Is she gonna live?
Yes.
I think
Okay.
I think it might have had rabies or something. It was a wild one.
It was a wild one? Okay.
A wild
So I
one,
think we're
okay.
gonna take maybe a culture of that and see what's all in there.
Okay.
I feel like we should get the dog.
For the culture?
Well, no, I think we should pay
okay,
the dog
okay,
to
okay.
come in.
Yeah.
So we might want to restart that. You said you were feeding the chipmunks.
Yeah.
All right.
I always feed them every morning.
Okay, and do you know where you were feeding them?
Somewhere by my house. I like this one tree by my house.
One tree by your house, and it just came up and bit you, or
Yeah, but this one looked like a vampire.
it looked like a vampire. Okay.
And
That's
it just
concerning.
usually I just feed them and they come and run up and I can watch them, but this one just decided to come to me instead.
Oh my gosh, I'm so sorry. Are you having any pain with your wound?
Yeah, I am.
All right.
It's burning.
It's burning pain. Okay, and then what would you on a scale from 0 to 10?
No temperature, just 98 degrees, but just thought you'd want to come see her and see what you'd like to order.
Yeah, I'll swing by pretty soon.
Great. Thank
Thank
you.
you, Nurse Lydia. Hello, Miss Cookie.
Hello, doctor.
I'll hope you guys have a good recovery.
Thank you, doctor.
Yeah, of course. The nurse will be in shortly.
Okay.
Thank you. All right. So what we're gonna do is we're gonna get you a rabies shot. One of the nurses are gonna do that. They're also gonna culture that for you just to make sure there's nothing weird going on in there. We're probably gonna start you on some antibiotics. Do you have any allergies to medication?
I don't think so. Do you know? I don't think she has any.
Okay, sounds good. And then we'll also get you some pain meds just to kind of help you.
Oh,
settle
that
down a
would be
bit.
great.
And then the nurses are gonna come in here and they're gonna teach you how to kind of keep that clean. And then I'm gonna recommend you make an appointment with your primary provider.
Hi, Mrs. Smith. How are you? I'm doing better. I got some pain meds and my pain's a lot better. And
Oh, perfect. So we're just gonna kind of clean it out a little
Okay.
bit, and then I will dress it for you so that you can keep it covered. We don't want to suture it or anything. We want to leave it open because since it is an animal bite, we want to make sure that we don't close anything. Like you keep it in the skin because that
yeah.
could make it become infected, which would be worse.
We
We
don't want that.
No, we don't. So I'm gonna put on some gloves, and then I'm going to get a syringe of just sterile water, and we're just gonna slowly just irrigate it out. And it shouldn't hurt. It might sting a little bit just because it is water in a wound, which is not always comfortable. But let me know at any point if you do feel pain, and I can stop. Okay.
Okay.
All right.
I just want to get that, whatever was in that chipmunk out.
Yeah, I understand completely. Alrighty. And I have, this is just a little syringe here, which I'm going to use to irrigate.
Okay.
Alright. And then I'm just going to go back and forth, okay? I'm just going to clean it out. Yeah,
How's
you
that feel? Oh, not too bad.
Yeah, okay, that's good. So, yep.
Oh, is that blood coming out of it?
Yeah, it looks like it might be a little bit of blood coming out.
Yeah.
Alright, it looks
Really
like,
got me.
I see that. He looks like he had some big teeth, too.
Yeah, he did.
Alright, I'm just gonna get some sterile gauze and just kind of dry you up a little bit, and I'll be nice and gentle. Again, let me know if it causes any pain at all, okay? Alright. Perfect.
Oh, that doesn't feel bad at all.
Good.
You are a
Alright.
good nurse.
Oh, thank you. That means a lot to me. Alright, I'm gonna just measure this output we got here. And then I'll dump that in the toilet in a minute. First, I'm going to put on a clean dressing. So we're just gonna use some gauze just to keep it kind of protected, but we don't wanna put a whole lot of pressure on it. We're just gonna wanna keep it
Yeah,
open. So
I
that it
don't
can
want that
heal.
to be out and about.
Yeah, animal bites we want to keep open just because that it's just better for them to heal. And then again, we don't want to close any bacteria that might be inside because who knows where that chipmunk's mouth would have been, right?
I don't think I want to know.
Yeah. You said he was a vampire?
He was not a normal chipmunk. I was thinking because it's kind of close to Halloween, he was like a
Oh.
vampire chipmunk.
Yeah.
But I don't know. My daughter, she didn't see it, but
Yeah.
I heard the stories.
I talked about it the whole way here.
Yeah, I bet. I mean, that's a crazy coincidence.
I called her right away.
Good. I'm glad that you were able to get here as fast as you
Oh,
did.
me too.
And all bites are not to be taken lightly. Because, yeah, we just want to avoid rabies. And rabies we need to treat immediately. So, but yeah, we'll know for sure with that culture that Nurse Lydia did if there was rabies or any other bacteria that was in there. All right, so I'm just going to put this gauze on over here. And then I'm just going to tape it down because we don't know where our transparent dressings went, but maybe the chipmunk stole it. So,
Oh,
They were just on something, aren't they?
those chipmunks. You know, I don't know if I want to feed them anymore.
You know, Mom, that might be a good idea.
I think I'm just gonna stick with birds.
birds, do you feed the ducks at all?
Oh, maybe I should start feeding ducks.
Oh, ducks are cute, aren't they?
Ducks are nicer than chipmunks.
They are. Have you checked out the duck pond here?
I haven't. Maybe that's what I'll do to help
Yeah,
me feel
they're
better
really
after
cute.
this.
They're very sweet.
I like ducks.
Me too. They're really funny.
But yeah, I don't want to waste my time on the chipmunks anymore.
Yeah, you give them food and that's how they repay you. It's not very nice.
I know. They should be nice to me.
Alrighty, there you are. You're all bandaged up, and then we'll let you rest and let that
Okay.
pain med still continue to do its job.
Okay.
And then Nurse Lydia and I will be back in a few moments to just give you some discharge planning and just how to take care of the wound at home.
Okay.
Okay?
Thanks, Nurse Emma.
Of course. Do you need anything while I'm here?
I don't think so.
Alright, sounds good. We'll be back in a little bit, okay?
Alright, how are ya? I'm doing so much better.
Feeling better?
Nurse Emma really got this bandaged up good.
Great. We just wanted to sit down with you and give you some information for how to take care of this when you're home.
Okay.
We'd love you to listen too, so you can help her out. Home with gloves and gauze and some water to help clean out your wound. How's that sound?
Good.
All right.
How often do we do that?
I think you're gonna want to change the dressing about once every 24 hours.
And then if the gauze, if you notice that it gets a little saturated or wet, you want to change it out pretty fast too, just because we don't want to keep it moist.
Yep.
Um,
We want the wound to stay dry and covered. So we're not gonna let it get any water on it. No showers with getting your arm wet or anything like that for now.
Okay.
Yeah, and we want you to watch out for signs of infection. So if it starts to hurt worse, or if it gets really red, more red than it has been, or if it smells weird at all, or if you notice any like drainage or pus that comes out and it's coming out a different color than it has been, all those are really good reasons to come in and get rechecked.
Okay. Well, I'm gonna be with my daughter a lot. She's gonna have to cook for me through all this, so she's gonna keep an eye on it for
Oh,
me
good.
too.
Yeah.
Yep.
We would like the family to be really involved. It's really important to us.
Yeah, she's a very good daughter.
Good. And let's stay away from those squirrels for now, or chipmunks, sorry.
I'm gonna do birds and ducks now.
Oh, good. Don't let those bite you either.
No, I don't want to do anything else with squirrel or chipmunks anymore.
Okay. That's a good idea.
all right, and then just to make sure you guys understood, do you know how often you're supposed to change them?
It'll be about every 24 hours.
Alright.
Or if it becomes wet.
All right.
And we're not going to shower the arm.
Perfect. And then, do you also want some ointment just to keep, just some like antimicrobial ointment that can also help with some bacteria and infections and stuff. So,
That sounds like a good
Good.
idea.
and yeah, it's important to you kind of want to keep the wound itself a little bit moist, just because that promotes a better healing environment for it. So we can definitely send you home with some antimicrobial ointment, and then we can discuss with the doctor about continuing pain meds just until you feel better.
I think that would be good.
All right, and continuing your antibiotics as well, which make sure that if we do get sent home with some antibiotics, that you finish the whole course. Just even if you do feel better or you don't think you need it anymore, we just want to prevent bacterial resistance.
Okay.
So it's important. To
Yeah, I don't want this growing.
No.
And do we just change it the same way that it is right now?
Yep.